One, two, three. Hello everybody, my name is Tom and I'm a second-year medical student, and in this video I want to give you 8 tips on how to survive gross anatomy class in your first year of medical school. Anatomy is one of your first classes in medical school, and it's really considered a rite of passage by physicians and medical students. A lot of schools are fortunate enough to actually have cadaveric dissection, where you go into the anatomy lab and you're able to actually dissect a real human cadaver, and that's a real privilege to have. And the dissections combined with the lecture portion make it a really interesting, really deep and detailed, but also difficult course. So here are the tips I have for you. The first tip I have for you is to actually go to your dissection labs and be active. A lot of schools set up their labs so that each cadaver have a few students working on it at the same time. So make sure you get in there and really get your hands dirty and do some of the work yourself, some of the dissections. Make sure you're getting up close and poking around and seeing where all the vessels are, seeing where the nerves are, making sure you can identify each muscle. Because when it comes time for the exam, that's going to help you a ton. Not to mention that having a cadaver and being able to go in and put your hands on it and work on it and dissect on it is a huge privilege. A lot of people will say that your cadaver in anatomy class is your first patient, and I think that's a really good way of looking at it. Use it to your advantage, be grateful for it, and make sure you get as much hands-on experience as possible with it. The second tip I have for you is to work and study well with your cadaver group, your anatomy lab dissection group. These are the people that you're going to spend all semester, all year even, around this body and looking through all the parts of the human body, and it's so much to take in. One thing to think about is that each body has its own twists and turns. Everyone is a little different. Your group is going to be familiar with you, with your body, and you're going to be able to talk with them about your body, what structures are where. And one of the best ways to actually study for anatomy is to, while you're at the dissection table and lab with your group, just ask each other questions. And to what you'd say in medical school and residency, pimp each other. You know, pepper each other with questions, just make them up on the fly, or you can even just, you know, take your dissection probe, point at something in the cadaver and say, what is this? Your group will appreciate it, and when they do it, I'm sure you'll appreciate it too. The third tip I have for you is to get an atlas. Absolutely get an atlas. This might be one of the most helpful things you can do. So the atlas I have and that I love is the Frank Netter atlas, and it is awesome. I don't want to flip through it just in case there's like a copyright issue, but this is absolutely the atlas I'd recommend. If you don't know who Frank Netter is, he was a physician, an MD, who basically ended up spending almost his entire career to medical art. And he has just beautiful hand-drawn diagrams of essentially every single structure and every angle of every structure you can think about. It's remarkable how he was able to do it, and they're beautifully done, and you can see how many there really are by just the thickness of the book. And I really recommend this because this is something that when you're at home and you're studying, you can open it up and you can look through it, because you're not always going to be able to go to the lab and look at the real cadaver. And so this is a really great resource to have. The fourth tip I have for you is when you're studying for anatomy, draw it out. And when I say that, it usually pertains mostly to the vasculature and the nerves. When you have these huge plexuses of nerves and these huge anastomoses of arteries, things going where, like the celiac plexus is a great example. It's so much easier to learn these by actually drawing it out. And I'm not a good artist by any stretch of the imagination. This doesn't have to be anything crazy. All it is lines and labeling the arteries. Just get a blank piece of paper and draw the arteries out and draw which ones connect to which ones go to which organ, you know, which nerves go where, and this will help you so much with the arteries, veins, and the nerves. The fifth tip I have for you is when you're studying anatomy, there are so many things that go together, so many muscles, so many arteries, so many veins, so many nerves, so many lymphatics. One of the best things that I did that would help me a ton is to make charts. And what I mean by that is make a chart where you have your muscles in one column, and then the next column you have the vein that goes to it, the artery that goes to it, and the nerve that innervates it. This will help you so much because so many anatomy questions on exams that you'll have in your courses and also board exams have to do with knowing what the muscle is and then being able to go back and identify what its blood supply is or what it's innervated by. For example, the forearm has so many muscles, and the forearm and the hand have so many muscles packed in here. It can be so crazy, and there's so many different nerves that innervate these muscles, different vasculature. So one of the best ways to understand those types of areas where it can get really confusing is just list the muscles and then side by side the nerve, artery, and vein. The sixth tip I have for you is whether or not you're an Anki person, I highly recommend what's called the Michigan Cadaver Deck. It is so good. It is an Anki deck, and if you don't know what Anki is, it's basically flashcards on the computer. But this is a deck that is so well done. It essentially is about 500 cards of pictures of different areas of the cadaver, and it has an arrow pointed to one structure in the picture, and you have to name that artery, name that muscle, whatever the arrow is pointing to. This is such a good way to practice at home because you're not always going to get to go to the lab, and these pictures are well done, the cards are accurate, and there's 500 of them, so there's a lot to do. It's a great way to study for your exams, especially the practical exams where you have to go into the lab and identify different structures. And I'll share a link to that deck where you can download it in the description below. The 7th tip I have for you is when you're practicing questions, when you're thinking of questions, and you can even do this in the lab when you're with your group, practice the second and third order questions, because those are the questions that are going to come up the most, not only on your course exams, but even more so on the licensing exams. So what do I mean by these second and third order anatomy questions? Your first order anatomy questions are basically just going to show you a picture of something and ask you, what is this? That's a first order, pretty simple. The second and third order questions, which are much more high yield in USMLE and COMLEX, are going to tell you something like, if nerve X is knocked out, what motion will you not be able to do anymore? For example, if one branch of the brachial plexus is knocked out, will you be able to supinate your arm the same way anymore or not? That type of thing. Looking at the downstream effects of various possible pathology and injuries. Another example would be if a blood supply is cut off, which muscle would be atrophied from it? That type of thing. 8th and finally, anatomy is important, but don't get overwhelmed by your gross anatomy course. There's so much to the human body. It's amazing, it's beautiful, it's complicated, it's detailed, and you're gonna get overwhelmed, especially since it's your first course, usually in most med schools, and you're thrown right into it. Don't get too overwhelmed. A lot of the stuff you learn in your anatomy class isn't actually tested on the boards. I don't want it to sound like you shouldn't be studying it. You absolutely should. The purpose of your anatomy course in med school is really to just get you oriented with the body and to understand how things work in it. You don't necessarily need to know all the nitty-gritty details once you're done with the course. Now, I'm not telling you to purge your mind of all your anatomy stuff. Definitely keep refreshing it. But when it comes to your licensing exams like USMLE and COMLEX, it's really just the much more high yield notes that you're going to need to know for that, and those second and third order questions, not identifying the tiniest random arteries in the pelvis. So try not to get overwhelmed and just keep studying. Also, I hope those 8 tips help you with your anatomy course. Let me know what you think. Let me know if you think there's anything I should have added. I hope you do great in the class. If you haven't started med school yet and you're coming up in this fall class and you're looking forward to anatomy, awesome. It's an awesome time. Don't be too worried about it. I know you'll do great. Just keep studying hard and hard. Keep looking at images. Keep doing flashcards. Go to lab as much as possible, and I'm sure you'll do fine. So keep studying and take care.